Okay. Hi, my name is Trisha and I'll be presenting about nikethamide. So, nikethamide is a respiratory stimulant that was once used to treat respiratory depression to make the breathing move slower. And even though it is good, you cannot take it for too much because it can cause poisonous. Thus, it stimulates the central nervous system, particularly the respiratory center in the brain, to increase breathing rate. And the mechanism of action for nicotinamide is that nicotinamide primarily acts on the respiratory center in the medulla oblongata, which enhance both the rate and depth of respiration. This action on the respiratory center is why it was firstly used to counteract with the respiratory depression. And then additionally, the mild central nervous system stimulant will effects which contributes to the respiratory stimulation. So next for the structure and nomenclature, as for the structure description part, you can see the picture where it is it is an amide derivative of nicotinic acid where the amine group is diethylated and it has a pyridine ring as a part of its structure. The IUPAC name is NN diethyl 3 pyridine carboxamide. Common name is coramine, trade name is dopran, and also the molecular formula is C10H14N2O. So the synthesis begins with a nicotinic acid, which is the parent compound of the molecule. Okay, so the nicotinic acid is then converted into nicotinyl chloride using a chlorinating agent such as thionyl chloride SOCl2. And in this step, the Cl2 will replace OH in the carboxyl group, forming nicotinyl chloride. Then, nicotinyl chloride is then treated with diethylamine, which replaces the chlorine with a diethylamine group to form nicotinamide. So, this is the overall view of synthesis pathway where you can see when nicotinic acid is used with SOCl2, the Cl would replace OH forming nicotinic chloride, and then that structure will react with diethylamine to form nicotinamide. That's all. Okay. Uh, Next, for the medicinal use of nicotinamide, is the first one. It can be used for respiratory stimulant, where it is used to stimulate respiration in patients with respiratory depression, such as those with respiratory failure or under sedation. Next, it can be used to treat hypotension. Like this drug will be used to manage low blood pressure, enhancing the cardiovascular response. Lastly, it can also be used as analeptic agent, which it is classified as an analeptic, meaning it can help to restore consciousness in any cases of poisoning or overdose. Next, for the side effect and reaction part, we will have five type of side effect, which is seizure, headache, anxiety, nausea, and vomiting, also insomnia. So for a seizure, it can cause increased risk of seizure activity, particularly if you take in a very high dose. Next, for headache is a commonly reported side effect. Next, for anxiety, potentially to exacerbate anxiety or induce panic attack. Nausea and vomiting, gastrointestinal disturbance may occur. Lastly, insomnia is where difficulty in sleeping may arise from stimulant effect. Lastly, for its application, there's two, which is it will be used for emergency treatment for respiratory depression, and also in the past it was using to improve respiratory function in case of respiratory depression or asphyxia. Asphyxia. So that's all from me. Thank you.
The second medically important heteroatomic compound is diethyl carbamazine, DEC. DEC is an antihelminthic drug used to treat filariasis, which is a parasitic infection caused by filarial worms, including infections such as loiasis and tropical pulmonary eosinophilia. As we can see from the 2D and 3D structure, this molecule has an N diethyl groups on one side and a methyl group attached to the fourth position of the piperazine ring and a carbamide group which is bound to the piperazine ring. Hence, the IUPAC name is N diethyl 4-methylpiperazine 1-carboxamide. The common name for diethylcarbamazine is DEC or hetrazine, and the molecular formula is C10H21N3O. DEC works by interfering with the cellular processes of the worms, making them more susceptible to the immune system, and this is usually given as an oral medication. The synthesis pathway for DEC is phosgene as the starting material react to diethylamine, releases HCl, which occur in the presence of pyridine, forming N-diethyl carbonyl chloride. Then, this reacts with piperazine derivatives, which is called as 1-methylpiperazine, releasing HCl and giving the formation of diethyl carbamazine. The medicinal use of DEC is to treat lymphatic filariasis. This medicine is a primary treatment for infections caused by Wuchereria bancrofti, Brugia malayi, and Brugia timori that can lead to severe swelling and tissue damage. It is also used to treat loiasis, which is an African eyeworm disease, by effectively killing the microfilariae in the blood, and treating tropical pulmonary eosinophilia by reducing the symptoms and clear filarial infections in the respiratory. This medicine has two effects on human, which are microfilaricidal effect and adulticidal effect. The first effect is DEC kills microfilariae circulating in the bloodstream, reducing the severity, and the second effect is DEC partially impact adult worms, decreasing the adult worm population over time. While DEC is effective, it may cause some side effects in human, often related to the body's response to the dying parasites such as Mazotti reaction, which is a common reaction in patients with high load of microfilariae. This medicine can also cause hypotension and other side effects such as nausea, vomiting, dizziness, and anorexia.
Thank you, Kasrina. Now we are going to discuss about histamine. In medical allergy testing, histamine is used to provoke a mild allergic reaction which helps identify any sensitive. Histamine binds to specific receptor in the body, playing roles in inflammation, gastric acid production, and immune response. To counteract unwanted effect of histamine, we use antihistamine. So these drugs block histamine receptor and are often prescribed for allergies, acid reflux, and other conditions. Besides, we have the two-dimensional and three-dimensional structure of histamine. Chemically, histamine IUPAC name system is 2,1-H imidazole 5-eel ethanamine, also known as beta-imidazoline ethylamine, and its molecular formula is C5H9N. Now, let's look how histamine works in the body. Histamine operates by binding to four main types of receptor, H1, H2, H3, and H4, and each located in different tissues and responsible for distinct effects. H1 receptors are found in the smooth muscle, endothelium, and central nervous system. When activated, they can cause itching, swelling, and smooth muscle contraction. H2 receptors are located in the stomach lining, where they stimulate acid secretion, aiding in digestion. H3 receptors, mainly in the central nervous system, play a significant role in regulating the release of neurotransmitters. And finally, H4 receptors are primarily found in immune cell and bone marrow, influencing inflammation and immune response. Next, let's take a look at how histamine is synthesized in the body. Histamine is produced from the amino acid histidine, and the enzyme histidine decarboxylase remove a carboxyl group from histidine, converting it into histamine. This synthesis occurs mainly in immune cells like mast cell and basophils, as well as in the gastrointestinal tract and brain. Histamine physiological roles mean it has a wide range of medicinal application, particularly through receptor antagonists. H1 receptor antagonists or antihistamine are used to treat symptoms like rashes, itchy eyes, runny nose, and sneezing. Common examples include loratadine and diphenhydramine.
H2 receptor antagonists reduce stomach acid production and are used to condition like ulcer and GERD. Examples include ranitidine and famotidine. To wrap up, histamine release in response to allergen leads to the inflammation and allergic symptoms. It also aids digestion by promoting gastric acid production and plays a role in appetite and cognition as a neurotransmitter.